Have you ever got a severe, sharp pain over your flanks? Such severe pain that you have to stop doing anything that you are doing and just rush to a hospital? Is that type of pain recurrent and it occurs every year or two, also associated with the family history? If yes, this is a video for you. I am Dr. Mehta, a consultant physician, diabetologist and a critical care specialist, and you are watching DoctorPlus, where I'll be a doctor plus something more, and we'll be talking everything about good health and everything good about health. So yes, you have guessed it right. We are talking about kidney stones, and it is such a pain that one cannot forget for their lifetime and would never have to have that type of pain for the second time in their life. Now, why does a kidney stone occurs? What triggers its formation? How to treat and how to control the pain of kidney stones? And what could be done to prevent the formation of kidney stones? We'll be talking everything about this in detail in this video. So kidney stones are basically the crystals of the elements that are excreted in our urine. It could be as simple as calcium stone, it could be a uric acid, phosphorus, or even multiple component stones. Now what triggers here the formation of the stones is the pH of our urine and the concentration of the elements in the urine. For example, acidity, that is lower pH of the urine, potentiates the formation of stones, whereas alkalinity could reduce the formation of stones. Also, higher concentration of the elements in the urine accelerates the formation of stones, and diluted urine decelerates the formation of stones. Normally, such crystals accumulates to become bigger and bigger in size, and a stone that is bigger than 3 to 4 mm causes a significant pain. There could be minor stones also, but they are usually not symptomatic. But once the symptoms starts, you should always be cautious. They could increase up to 10, 12, even 15 mm in size depending upon the location of the stone formation, starting from kidneys itself towards ureters, that is the tubes that carries urine from kidneys to the urinary bladder, and even stones can form within urinary bladder itself. However, it is important to note that kidney stones that occurs within the kidneys have quite a less degree of pains as compared to the ureteric stones, because ureters are very thin tubes, and even a minor stone could create spasmodic constrictions of these ureters and cause severe pains, whereas kidney stones could accommodate bigger stones also, and those stones could be completely asymptomatic sometimes. So it is very important to note that what is the size and what is the location of the stone within the urinary system, and that will decide the further management, preventive strategies and likelihood of surgeries for the management of stones. Now usually a stone that is of the size of 3 to 4 mm till 7 to 8 mm can be managed conservatively with the fluid therapies and medicines, but stones that are bigger, that means above 10 mm, usually requires intervention in form of laparoscopy or catheterizations. Now it is frequently observed that many of the patients are skeptical and scared of surgeries for renal stones, but let me tell you, if the size of the stone is bigger than a certain limit, you have to go for an intervention to remove that stone with either catheter followed by stenting. And this is important because if the stone keeps itself at its place and if it keeps increasing in size, it can always cause obstruction to the flow of the urine, and that might cause damage to the kidneys. Also, it is very important to note that pain itself is not a single criteria to decide whether to go for a surgery or not. The only significant criteria that decides whether to go for a surgery or not is the place, the location of the stone, and the related damage it may cause to the kidneys. For example, a stone that is around 10 mm is causing obstruction to the urine outflow and has started causing dilatation of the ureters and followed by a minor kidney damage, requires surgery at the earliest. Because you will be surprised to know that a damage done to a kidney following a stone formation is usually irreversible. So you have to protect the kidneys at any cost. Even if the stone is not causing any pain, still the surgery is needed to save kidneys from further damage. So now we'll be discussing what are the causes of the stone formation. The first and foremost thing is the content and the consistency of the urine. That means the pH of the urine, the specific gravity of the urine, and the content, that means the concentration of the elements like calcium, uric acid, and phosphorus. So if those patients who have higher amounts of calcium or uric acid in their urine and have concentrated urine, have higher tendency of formation of renal stones. Also, it is very important to note that tendency of stone formation is familial. That means if you have a family history of stone in your parents, grandparents, or blood relatives, you have a higher chances of getting the stone. So that makes you more aware and more cautious about impending stone formations. Also, one more fact check. Summers are the seasons where you have very high incidences of stone formation because due to dehydration, your urine might get concentrated and that will cause an increase in the tendency of stone formations. One more important cause is medications. Yes, medications and drugs that you take for other purposes like blood pressure, diabetes, multivitamins may cause an increase in the excretion of certain types of chemicals in your urine, and that might cause a nidus of stone formation, and it also increases the chances of stone formation. So for those patients who have higher tendencies of stone formations, should always consult their doctor before consuming any over-the-counter medications. Infections and renal stones always go hand in hand. That means they are always correlated. If you have a renal stone, there are always higher chances of urine infection. Also, if you have a urine infection, there are always a higher chance of kidney stone formation. So, to sum up the video, I would say a 3 to 4 mm stone till 7 to 8 mm can always be managed conservatively or with medicines. But if your stone is bigger than 10 mm, any location, always consult your doctor and go for an intervention if there are signs of kidney damage in form of back pressure changes or kidney function deterioration. So, this was all for today, and I'm pretty sure all your questions and doubts about kidney stones are now answered. I am Dr. Mehta, a consultant physician, diabetologist, and a critical care specialist, signing off for today from DoctorPlus, where I'll be a doctor plus something more, and we'll be talking everything about good health and everything good about health. Do subscribe to our channel, do like the videos and share the videos to everyone you feel this video might help. Also, do comment your doubts on health and disease. I'll be more than happy to help. See you till the next time, and do take a very good care of yourselves. Bye.